Research institutions are not trusted. People think they're only here to grab the information, they leave.
We don't pathologize these communities where we just come and look at what are the problems, what are the challenges, but we look for what are the solutions within the community.
All the signs, all the manifestations of apartheid exclusion continues.
We often strive for change once it's too late.
Our research has to translate into everyday life.
If all of us as human beings can just see that we have a role to play in society, we can be the change we want to see.
The Institute for Social and Health Sciences has been in existence for about 35 years.
So the Institute was started in the mid-1980s, a time of lots of trouble and tension in our country. The beginning was really trying to sensitize health personnel in the primary healthcare system in Soweto to traumatic brain injury, its symptomology, its signs, and kind of its manifestations. And interest shifted to understanding violence and its manifestations, recognizing that apartheid itself was a violent formation, a violent system. So from the onset, the focus of the Institute is always trying to understand violence and how to go about preventing it.
And it's developed into a formidable organization. I would call it almost a center of excellence with a very successful history of community engaged research.
Material conditions for South Africans, in fact, have deteriorated. South Africans have to be a part of this debate and engage and take a position, take a stance on it.
Apartheid in its formal, institutionalized form, it's no longer in the books, but the everyday forms of apartheid persist.
People are still living without toilets, without access to water, still living in shacks. We've been socialized when we grew up in the apartheid era. That is impacted on how people think and how people connect, and there's a sense of suspicion and mistrust at times.
All of us living in this country, we live with this anger, the resentment, just the divisions. We live with it in our bodies. And the slightest trigger or aggravation sets us off.
I think in broader public discourse in South Africa, there's an idea that protests are extremely violent. Often protesters are portrayed as villains. And I think what our project has explored is how protests are really a form of democratic citizenship.
We don't position ourselves as neutral agents in the making of knowledge. We very consciously think about our work as a politicized form of knowledge making.
Research has to be useful to people, not just academics.
Communities are centrally involved in the decisions that are taken, in the way that we work and what we decide to do within the communities. So it is participatory, it is collaborative, and we focus on how the work we can do can be sustainable over the long term.
So this space that we are in currently is a safe space. We've engaged with communities in partnership as well as government and other NGOs, because they see the space, as a very peaceful space where they can talk freely.
So community engagement actually allows you to go into people's lives and actually get to understand their everyday struggles. And also it allows you to fashion new solutions to the problems that people identify.
Our unit has done a lot of work that foregrounds engagement and community and participation in ensuring that community needs are met, material needs as well as social needs are met, that safety is considered holistically, and that communities participate in having their needs and their safety needs in particular met.
The community is the context in which you live, you grow, and you're socialized, and it is that environment that really determines your quality of life, your educational opportunities, or any opportunities in life.
We think very carefully about the materiality of our research and scholarship. And our community engagement work is very much embedded within that thinking.
It's a way of giving back to the community, it's a way of giving back to the research society as well.
We serve as an internship site, so we receive master's students. We also train and supervise doctoral students. We're also a site for postdoctoral students.
We provide a structured program for the interns, the master's psychology interns. So we try to get them practical experience in every aspect, so once they leave they feel well-rounded.
I think it's a great learning experience and great exposure to multiple different things in academia, in advocacy, in policy.
It's really about putting in the effort, putting in the work, and realizing that you have done research which really aims to help broader society.
It never sort of allows itself to get sort of too abstracted or far-flung. It kind of always tries to bring it back. The usefulness to people sort of on the ground is always emphasized.
It's really about animating radical hope. You know, we need hope. Hope is what carries us and helps us wake up every morning, fires our imagination, helps us understand and imagine a different world, a different reality to the one we have.
It has been a space that has been critical of where South Africans' needs are not being met.
We need to disrupt, fracture, hopefully make notable contributions to society and communities we will engage with. And I think we have to be bold as researchers. We have to be bold.